Welcome back. Dr. Michal Izrael is the VP of Research and Development at Cadima Stem. She joins us now to tell us all about making magic with cell therapy. Hey, Dr. Izrael, thank you for joining us.
Hi, it's great to be here.
Well, we're very happy to have you. So we want to know, tell us, what's the latest in cell therapy developments these days?
Okay, so let's start. What are cells? So cells are the building blocks of our body. So imagine a world, okay, that we can transplant healthy and functional cells to treat and even cure any type of disease. So the beauty about this technology is that we can take stem cells, very young cells, and turn them into mature cells, such as liver cells, brain cells, etc., and grow them in very big quantities.
Now, can you tell us a little bit more about what Cadima Stem is doing right now overall?
So in Cadima Stem, we are producing two cell products. One for the treatment of ALS, which is a devastating neurological disease, and the other one is for diabetes.
Unbelievable.
And for the ALS program, we are producing or using these young stem cells and producing astrocytes, which are the brain supporting cells that enables the signals from the brain to reach and activate the muscles. So in our first in human clinical trial, we have found that this cell therapy is safe and it maintained the patient's steady state for a duration of 3 months, which is very encouraging results. And we hope that in the near future, we can do a repeated injection of these Astra cells, the astrocytes, and have better results. So it's going to be, I hope so, in the next year. And as for the diabetes, we are not making a treatment. We are actually making a cure. So patients with diabetes won't need to test their sugar levels, won't need to inject insulin. So the cells will function as insulin secreting cells. And we are using the same technology. We are taking young cells, stem cells, and turn them into insulin secreting cells. And by selecting only the best of these cells, we can have a very good product in which we can transplant the cells. And indeed, in preclinical studies, we have found that these cells can maintain the sugar levels of the diabetic animals tested.
Oh, wow. Okay.
It's overwhelming, I know.
All right. So I want to know, how did you get into this field and ultimately become the expert that you are?
The last 2 decades, I'm living, sleeping, eating cell therapy, started at the laboratory of the famous professor Michal Izrael that invented already a blockbuster for the treatment of multiple sclerosis. And he's very good in taking ideas and making them become true.
What does cell therapy hold for the future of medicine?
Yeah, so here the sky are the limits. You know, with the right funding of this project, we can make from these cells, we can make organs, tissues, and then replace any malfunctioning organs such as the heart, the pancreas, and etc. So the sky are the limits.
Wow. Well, that's so exciting to hear and very interesting stuff. Thank you so much for being with us.
Thank you for the kind invitation.
Of course. Thank you so much.